So I'm delighted to be doing a three-part series with Dr. Priyanka Sarawat, a renowned neurologist from India, talking about conditions that are on the bubble between neurology and neurosurgical treatment and how to differentiate them. We'll start by talking about transverse myelitis versus spinal cord tumor. These kind of consults are ones that I've received multiple times over the course of my career, and fortunately I've never had to do surgery on a patient with transverse myelitis, mainly because of colleagues of mine who have allowed me to make the differentiation between the two. So we'll start with Dr. Sarawat, who'll talk about transverse myelitis, and then we'll talk about how to differentiate that from a spinal cord tumor.
Transverse myelitis is inflammation of the spinal cord spanning across multiple segments. It can not only lead to weakness of your limbs, it can also lead to numbness, that is loss of sensation, and loss of bladder control. How do you diagnose it? One, MRI. So when you do an imaging of the spinal cord, you will see diffuse cord swelling because of the inflammation or underlying infection affecting the cord. And second, a cerebrospinal fluid analysis, which will definitely show you increased inflammatory markers. How do you treat it? Now, it doesn't need surgeries to be treated because it is because of an inflammation of the cord. It needs anti-inflammatory agents, that is injectable steroids. Patients respond very well to anti-inflammatory agents in this scenario. If infection is the reason, or you find out the reason in your cerebrospinal fluid, a specific reason, you treat that infection, you treat the patient.
So the distinction between transverse myelitis and spinal cord tumors is critical because transverse myelitis is treated almost always non-operatively, whereas spinal cord tumors usually require surgical extirpation. So how do you make the diagnosis? Number one, discussion with a qualified radiologist is important. Transverse myelitis typically occurs in the cervical and thoracic spine and spans several segments involving diffuse expansion of the spinal cord itself. Secondly, CSF analysis can be helpful. In transverse myelitis, you'll oftentimes see oligoclonal bands, which will make the diagnosis, which you won't see in spinal cord tumors. Finally, when the diagnosis is unclear, a trial of steroid medications can often help because for patients with transverse myelitis, a lot of times we'll see dramatic improvement with steroids, which may not be seen in the case of spinal cord tumors. In some cases where you really can't make the diagnosis or where a patient's rapidly deteriorating, surgical treatment may be required to make the final diagnosis, but this is generally not recommended in cases of transverse myelitis.